Hello guys, and welcome to Showtime TV Live here at My Health is My Wealth with me, Washirage Konyo. Thank you so much for joining us for this episode. This is a show where we educate you about your physical health. Now, today we are going to talk about sickle cell anemia. I don't know if you've ever heard of somebody who suffers from sickle cell anemia. So we are going to look at some of the information about it, know about the disease, know about its symptoms and how it can be managed and treated. Now, sickle cell anemia is a condition that affects the red blood cells. Before I go to the red blood cells, let us look at the functions of the red blood cells. But before then, let us look at the components of the blood. The blood is composed of the platelets, which are responsible for blood clotting. When you cut yourself, and then there is that clotting that comes to prevent the bleeding. It is normally by the platelets. We also have the white blood cells, which are normally for preventing the body from getting external diseases. They are like the soldiers for our body. Then you have the plasma, which is responsible for transporting essential minerals in our body. And then we have the red blood cells, which are responsible for transporting oxygen in our body. Normally, the red blood cells are round in shape, and the reason why they are round in shape, it is to give them a good shape, which can help the white blood cells to enter the vessel so that the oxygen can be transported to various organs. But when somebody has sickle cell anemia, it means that red blood cell is distorted. It is not round in shape. It sort of forms a crescent shaped red blood cell. So meaning that this from the word sick, that's why they are called sickle. It's called sickle cell anemia because the cell sort of has a deformity. That's why it is from the word sick. So now the red blood cells becomes crescent in shape. So when it is like that, it means that it is not able to transport oxygen throughout the body. It cannot fit in the vessels. So when somebody has sickle cell anemia, it means that the hemoglobin sort of has some infection that makes the red blood cell become deformed. So what causes sickle cell anemia? Sickle cell anemia is a genetic disease. When I say a genetic disease, it means that it can be transmitted from two parents who are infected or who have the trait of the sickle cell anemia. It can be genetically inherited by the child. When both parents are infected or have sickle cell anemia, and then they transmit one sickle cell red blood cell to a child, and the other one transmit, the child is said to be sickle cell anemic. But when one parent has normal red blood cells and the other one has sickle cell anemia, and this one gives a sickle cell a normal red blood cell to the body, and the other one gives a sickle cell red blood cell to the baby, it means that this a child is a carrier. It means that this child can transmit it to the generations to come. Now let us look at the symptoms of sickle cell anemia. Remember that when you have sickle cell anemia, it means that the oxygen cannot the vital organs. So means that the vital organs such as the kidneys, the liver, the lungs, the heart will lack oxygen, and they can actually be infected. We also have most people who have sickle cell anemia have lots of pain, because you can imagine if red blood cells normally, normal red blood cells normally last for between 90 to 120 days. But sickle cell anemia, red blood cells which are sickle cell, they normally last for 20 days, and so the body destroys these cells so many times, and because the body cannot keep up with the destruction of the red blood cells, these sickle cell red blood cells, in a short time, that is when somebody is said to be anemic. Now the pain comes in when the red blood cells are trying to squeeze themselves in the in the blood vessels to transport the oxygen, because as I've said earlier, the red blood cells are normally round in shape. They are designed in a way that they can fit in the blood vessels. But when you have sickle cell anemia, the red blood cell is normally crescent in shape, and so we are going to have them getting stuck in red blood in vessels, and that causes a lot of pain. So one of the major symptoms of a person who has sickle cell anemia is severe pain. We also have the white part of the eye will turn yellow, a condition called jaundice. Then we also have the other part that I have said, over time it can lead to the damage of the major organs. In babies, you will notice that their hands and their joints are red, or they are in so much pain. So it is good that we know how do we manage sickle cell anemia. Sometimes there is a treatment, but we are going to talk about the treatment. But in most cases, sickle cell anemia is normally managed because of the pain and everything, that all the diseases that could occur with the body lacking enough oxygen. So we normally, the doctor normally gives some treatment which you are going to look at. So we have the first treatment is the medication that you are given is meant for helping normal. You are given some sort of medicine, some antibiotic or some medicine that is given to help the body produce normal hemoglobin. Remember that the distortion of the hemoglobin, if you don't have normal hemoglobin, that protein that is responsible for transporting the oxygen through the white blood cell, it's the one that causes the cell to form that crescent shape. So there's medication that is given that the patient is able to produce normal hemoglobin, and so there's the production of the normal red blood cells. And so another treatment that is normally given to patients with sickle cell anemia is the folic acid. Folic acid is given in plenty, and it also helps the patient. Also, we also have vaccination, not against the sickle cell anemia. Vaccination is given to the patient to prevent them from getting diseases that could occur as a result of the person having sickle cell anemia. For example, flu. Somebody can be given a vaccination for flu, because that is one major condition that will occur in patients who have sickle cell anemia. The other one is the person is also given antibiotics to treat infections that could occur maybe in major organs or in the body. So somebody is given antibiotics, and also in some cases the blood transfusions are given. So we have blood transfusion. Blood transfusion is the giving blood from one person to another. And remember, when you talk about blood transfusion, you should not be scared about giving blood or receiving blood in case you get into trouble, because normally this blood, before it gets to the patient, it's normally tested for HIV, it's tested for so many things, it's tested for blood groups. Remember that you have various blood groups, and if you're not careful, it could cause something we call agglutination of the cells. So it is very, very important that you know that when you're giving your blood or you're receiving blood, it is normally tested. So blood transfusion is also another treatment that is given to sickle cell anemic patients to manage the condition. Now, there is a cure for sickle cell anemia, but it is called cell transplantation. It means that cells are the white blood cells you are donated for the red blood cells. But now this condition, this kind of treatment is very, very risky, and before you undergo that kind of a treatment, it is good that you consult your doctor, because it is a very, very delicate process. So it is good that before you decide to take that as your way of treating the sickle cell anemia, it is good that you talk about it with your doctor. So the only thing that is that normally is there with managing the sickle cell anemia, it is pain management. You are given painkillers that could help you manage your condition. Remember that is genetic. Most of the time, if you don't get the cell transplantation, it means that this patient has to work with controlling the pain and treating the infections. Now, let us look at where Where is sickle cell anemia found? Most of the people who are affected by sickle cell anemia come from various parts of the world. Now, it doesn't mean that if you come from a different part of the world that you won't be affected, but research shows that sickle cell anemia normally occurs in the sub-Saharan Africa. Sub-Saharan Africa, we have sickle cell anemia there. We also have the Hispanic areas of South America. People who live there also have many cases of sickle cell anemia. We have the Caribbean areas. We also have Saudi Arabia, Indian, and the Mediterranean countries. Now, for those who are watching us live, I will wish that you also give your comments, or probably if you've ever had an experience of somebody who has have had sickle cell anemia. This is a very, very painful condition, and it is good that if you have a patient, or you have experience, or if you're a doctor and you could help somebody who has sickle cell anemia, it is good that you share it live. When I look at Facebook, let me see some of your comments. Please make sure that you keep the comments coming through, so that we also help this patient. So it is good that also another symptom that I forgot to say is normally you have a lot of fatigue. When you don't have oxygen, it means that you can lack enough energy for your body. So it can also cause a lot of fatigue. It is good that you also look out for symptoms of children. When children are born with sickle cell anemia, they have sometimes they do have a distorted growth. A child with sickle cell anemia will look younger than their age, and they will most probably be in a lot of pain. And also another thing that people need to know is that men who suffer from sickle cell anemia can have a painful erection that is absent from sexual desire. It means that this man can get an abnormal erection that is absent from sexual desire. So, and if it is not treatable, it could lead to dire results. So it is good that we know how to manage this. So keep those comments coming in on Facebook, and those who are watching us live on Facebook, let me check some of your comments. If you have anything to add, or if you have any questions from the audience, maybe let me look at what we have here. It's showtime. We have Mike, Washington DC. Thank you so much for joining us. You say great job. I hope I have done enough research for you. It's not much, but also remember that this video is not it is just for informing you. It's a research that I've done, and I have also sought medical information from qualified doctors for me to come and give you this information. But if symptoms persist, please go and visit your medic. We have Spectacular, thank you so much. And also don't forget to catch his show on Sundays on Zuru Africa on Showtime TV. Very informative. So somebody he has also said sikujua sickle cell ikona cure. That means that he says that he did not know that sickle cell had a cure. Yeah, there is a cure, but that involves a lot, and it is very, very risky, and that's why I said that you should seek medical advice before you go for that option. Okay, thank you all for tuning in. We have sensitizing on sickle cell anemia. Yes, thank you so much. You say Michael Derry says this cancer issue killed my classmate at university. I am so sorry about your classmate. And well, it could be managed. Well, people will say that the life expectancy of a person with sickle cell anemia will be cut short, because most of the time it affects the major okay, fine. If you don't seek for the cure, it is good that you manage it. So if you have good diet, and you've managed the pain, and you manage all the diseases that could occur as a result of sickle cell anemia, you can live for as many years. I'm so sorry. My condolences, Mike on Derry. We have Mike Derrick who say we are grateful to have these shows every time as youth. It is very, very good that youth out there, if you have any information that you'd like to share, especially about people's health, doctors out there, come, let us train the people about some of these diseases. Remember, we have looked at cancer, we have looked at cervical cancer. I shared that. If you haven't watched that, please make sure that you catch the episode that I gave an analyzing of cervical cancer. We also had doctors from Mary Soaps who came here last time on our last show, and they taught us about reproductive health. They talked about HIV. So it's good that you catch this show every Tuesday for you to get an information about a certain disease. Then again, we have Mike Derrick again saying very impressive. When I go to YouTube, let me see what people are saying there on YouTube. Let me see. So keep the comments coming about sickle cell anemia, So maybe I could look at maybe some of the audience who have questions. Maybe they could ask me so that I can also add it on my show in case anybody could help in the comments. It can be very, very good. So generally that's it about sickle cell anemia. Please make sure that you have also commented below on the disease that you'd like me to cover on my next episode. If you want me to cover anything, I can call any medic. The next time we are going to have a herbal person coming in with their products, and they are going to give you information about some of the herbs that we have that can be used to probably even manage some conditions such as cancer and sickle cell anemia. Remember that sickle cell anemia is not cancer. It's not cancer, it's a genetic disease. And also cancer can also be a genetic disease, meaning that it can be transmitted from parent to a child. I mean, it can be inherited just like sickle cell anemia. So thank you so much. I hope that session was good enough for you to understand. So let us watch out for these symptoms, and if you are going through it, know that there's professional help, there's advice, there's treatment, and there is hope. It doesn't have to be a death sentence. So it is just good that you seek medical advice if you have experienced some of those symptoms that I have talked about. And it doesn't mean that every time you experience these symptoms, it has to be sickle cell anemia. There are other conditions that could cause such kind of symptoms, but these are some of the symptoms that you could watch out for when it comes to sickle cell anemia. Now, that is my research for today. My health is my wealth. Thank you so much for joining me. Catch this episode every Tuesday at 7:30 with me, Washerage Konyo. And I have said before, if you have any ads to place, if you're a doctor out there and you'd like to give information, comment hapo chini on Facebook. We are live on Facebook every Monday to Saturday. Every Monday to Sunday we have shows right here at Showtime TV. We also have a studio called Showtime Studios where we take photography, best photography. So visit us at Pumpkin House, 3rd and 4th floor in Nyeri town along the Kimathi Way. I have been your host for My Health is My Wealth, Washerage Konyo. I'll see you on the next episode, and please stay healthy. Thank you so much.